Hey girl, hey.
Hey.
All right, we're gonna dive right in. So our Hey Girl Spotlight, Paige Mitchell of Front Page News. Kimberly Callaway is certified physician assistant. I mean, she has a background in internal medicine and I don't want to say plastic surgery. It's not plastic surgery. Is it? Okay, okay. I'm trying to find a medical terminology, trying to sound smart. Um, but talking about how their industries, their backgrounds have been affected by the coronavirus. And LaShawn was just talking about Kimberly is LaShawn's sister, her little sister, and how you do a check-in with her, and just how Kimberly, your demeanor, according to LaShawn, is just always kind of upbeat, like, hey, hey, hey. I get concerned only because it is being reported that a lot of those who are working on the front lines, they're holding a lot of it in. And so, how can us as the family kind of still pay attention and give you guys space at the same time, but show you that we're concerned so that there's no situation that happened in New York where the doctor, unfortunately ended her life due to all the overwhelming stress related to the virus. So any input?
Yeah, I think this is the coronavirus is so much different than any situations that have come in the past in regards to, healthcare professionals are always out there to help other people and sacrifice, you sacrifice your time. But this is a little different in the sense that there's fear also associated with that because all of our contacts could potentially be affecting us as well. And so, that's totally different. You never think about, going home and what are you bringing home to your family? And so I think that this is a whole new realm for healthcare providers because every day when you get up and you go into work, you don't know, is that the day that potentially you may be infected yourself?
Right.
And so from that standpoint, I do think it's actually a different level of stress for healthcare providers who are on the front lines, who are seeing patients, because when you come home, one, you have to keep the distance from your family.
Right.
But secondly, you're dealing with a different level of stress. It's almost like akin to being like an award show,
Yeah, that's what they call it. Yeah.
Because you just don't know when you're caring for somebody what are you going to bring something back with you that will then affect you and the people that you love.
Right.
So I think it's helpful actually as family members of those who are healthcare providers to like my sister does, which I truly appreciate, is check those check-ins. Hey, how are you doing? How are you feeling? Checking in and just seeing, how they're surviving. Because this is a different kind of battle this go round.
What are some of the sorry.
No, I apologize. Go ahead.
That's fine. What are some of because I used to work in a doctor's office and it was constant traffic, of course, and I don't work in a doctor's office no more, but still for a healthcare provider. So I still have to go in like once a week, but we're like very precautious, like we got to wear masks and things like that. What are some of the safety precautions that you guys are doing in your hospitals, being that you are still open and have to work?
Good question.
So, it's been kind of an evolving situation, just like it's been evolving for the general public. First it started out that we were, you just had to wear a surgical mask, and then, all the way to now where we're being fitted for the N95 mask, we're wearing shields, hair bonnets. We're essentially covered from head to toe, depending on what your exposure is to patients who potentially have coronavirus. But that's also been scary too, is because, 1 week you're told one thing, like, oh, a surgical mask is enough. And then 2 weeks later, now you got to have an N95. But it's like, hey, but wait a minute. A couple weeks ago, you told me something completely different.
Yeah.
Right. So I think there is a level of, trust and building that trust when the higher ups in government facilities are telling you that this is what you need, and then 2 weeks later you get a whole different story.
Yeah.
So I would say, if there's in any situation when you're going out, always do more than you need to do.
Yes.
Is what I would say.
Yeah.
You know, when you're out and you see people, well, not everybody has masks on. If you have a mask in your pocket, put that mask on. Do more than you need to do, because you know you can never. That's the thing. One of the things that I take issue with is that a lot of these screenings that they're doing, when they ask you questions, one of the first questions they ask, if you go, like, for example, into a medical facility, they ask you, have you been around anyone who's been exposed to coronavirus? Have you
Right.
yourself been exposed? And then the next question they actually ask is, do you have any symptoms?
Right.
Well, as long as you say, no, you have no symptoms, then you're allowed to proceed. But
Right.
they're
Yep.
forgetting that the majority of people
Are
actually
asymptomatic.
are asymptomatic. So what did that answer?
Yeah.
So it's not so just in thinking about when you're interacting with somebody, you know, you ask, hey, you got any symptoms? Well, just because somebody doesn't have any symptoms does not mean that it's okay to then relax the social distancing or stand closer or bring your mask down to talk, because those are the ones actually you should really just kind of respond as if everyone has it.
Yeah.
Symptoms,
Right.
no symptoms, you know, you should just anticipate that everyone has it, and then that's how you'll be the most cautious, is what I would say.
Okay. There's another question I wanted to ask Paige something. Anyone else have a question?
No.
I mean, because there's different symptoms that come out like every day. Like at first, you know, there was one where if you have a headache, or if you lost a sense of smell, you know, taste and something. And I mean, for real, I was going around, and you know, my nose is quite a size. It's, you know, it's a nice little size. I was like smelling everything, like, you know, like, 'cause what if I'm one of those people? What if I'm one of those people that, you know, carrying around and don't know? So I'm like sniffing everything. I'm like, oh, that smells good. Oh, that stinks. You know what I mean? I'm like just happy to have that kind of sense. But there's just every week there's a different symptom.
It's a different thing.
How do you keep up with it when there's something different every week?
Exactly. And I know it's like, how can you differentiate? You know, I mean, I know there was like a list, like, oh, you may just have a cold, you may just have the flu,
or allergies, right?
Allergies, and I have allergies, so it's like, and around this time of year, anyways, my allergies act up, you know.
Right.
So it's like, I don't want to scare myself, but how do I know if it's allergies or the coronavirus, you know? And are they still doing the drive-through testing? And then I'm hearing you have to have a prescription from your doctor or something like that. So it's like, really, how do you know? You know what I mean? Like, or am I scaring myself? You know, and I don't know. You know, and I still have to go outside of some sort. You know, because I still go into my job one day a week. I'm still going to the grocery store. So, you know, I'm trying to be precautious at the same time, but you know,
like she said, just do more. You know, if what you can have, if you can have your mask and you have your gloves and you have your hand sanitizer, and you can just remember to clean you know, stay 6 feet apart and continue to wash your hands and not touch your face. That's the best thing that you could possibly do. Because you know, I think even Dr. Fauci even said, like, we're still learning this thing. You know, we just it's everybody's learning. So all the information that they're getting is from the doctor's assessment that they have with the patient. So everything that the patient is telling the doctor, they're documenting it, and they're saying, okay, so now they're putting all this data. You let me know, Kimberly. They're putting all this information in the database, and they're collecting it, and they say, okay, so 80% have fever that range from this range from that range, or 60% have stomach flu, or 20% is fatigue or shortness of breath or something like that. So that's how they determine, and that's how they figure out where it's coming from or what the main symptoms are. So as long as you continue to contain yourself and keep yourself safe and keep yourself at a safe distance, then you should be pretty good. I mean, so just from me watching all the TV that I've seen. It's a lot. It
is evolving, and yes, I would say it can be difficult, especially when you have symptoms. You know, we're in spring. This is springtime, so a lot of us may be having stuffy nose or maybe coughing. But what I would say to you, because I experienced that as well, because I get spring allergies, and then I started thinking, because I'm, being exposed regularly, shoot, is this, am I dealing with coronavirus here? And I'm thinking it's my allergies. But what I would say is that you have to go with history. So, for example, if you're going outside and you're getting a runny nose and you're getting a little bit of cough, if that's what you get every spring, then that's probably the same thing.
Right.
If it's something more like, hey, wait a minute, now I feel like I'm getting a little chills, I'm getting a little achy. Yeah, it's my allergies, but my cough is worse than it usually is. That's when you would be suspicious, because it's something out of the ordinary. It's more than what your usual symptoms are. And there's also the component of, if it's your allergies, well, then you should be able to take allergy medication and it get better.
And that's what I do.
And you still want to follow the same precautions: washing your hands, not touching your face. You know what I mean? Sneezing into your elbow, coughing into your elbow. You still want to use those same, practices, but.
So now when people sneeze, people jump like cats.
Yeah.
You
They're like, or a cough,
like,
it's like you gotta hold it in, and then your chest hurts and your eyes is getting red and you scared, you know what I mean? Do the normal. Like
I went through a whole different aisle in a grocery store. I was so mad because y'all know I like
I'm not.
And normally I'm the one that's like, no, I'm cool. I'm not. But this sneeze was so loud. I was like, oh no. I think that went like 15 feet. So I went around and I was like, Lord, you don't want me to have these patients. That's what it is. I'm good.
Okay.
I rolled out.
One more question, for Kimberly, really quickly.
Okay.
Just coming from a professional standpoint, when do you think this will all be over? Just from what you see, like when would you think it'll be cleared up?
Yeah, I don't see this ending, given everything that we're hearing for quite some time. I think that until we get a vaccine, and we don't, unless we get a vaccine or we get a treatment, then I think this is going to be going on for many, many months.
Yeah. Agreed.
I want to just get this out. I want to thank both Paige and Kimberly for being on the show today. The guys got to take over for Urban Media Today Talk Sports. There's so much to cover. And Paige, we're going to have to get you on the show again. Kimberly, of course, always welcome to be in. Your magazine is available this weekend, correct? It'll be what? How can we get it?
So that's another thing that impacted the magazine with everything going around COVID-19. So I had agreements with 7 different Pittsburgh local businesses to house the magazine, but now those businesses are down. So that messed up a lot of things with the functionality of the magazine as well. So right now I'm strictly doing magazines online through PayPal. Everything is pretty much directly through me at this time.
Okay. So what we're going to do is we're going to add Paige's information. Kimberly, if there's any email information or maybe a phone number to your office, if anyone has any questions, we'll add that to the posts at urbanmediatoday.com. Also, thisradiochickrocks.com. Our time is up, y'all. Man,
okay.
It was getting juicy.
That was fast.
It did go fast. But thank you so. Go ahead, LaShawn.
They have to know how to reach us. They can reach us at the Hey Girl Hey Podcast at gmail.com, or you can call us at 412-709-6130. Leave a message if you have any ideas or topics for our show.
And Jared, where did Jared just? Okay, she
left. Just dropped. Millennials.
Find us on social media. No, find us on SoundCloud, Apple Podcasts, Spotify.
Okay, I don't know what happened. I'm sorry. It just went like disconnected all of a sudden.
Real quick, tell them how they can hear us.
Y'all can find us on SoundCloud, Anchor FM, Apple Podcasts, Spotify, Live 365 and urbanmediatoday.com.
This is the Hey Girl Hey podcast on Urban Media Today. I'm Radio Chick Kiki Brown.
I'm the Chatter Chick LaShawn Tipton.
And I'm the millennial chick, Jerry Tipton.
You guys have to have chick names. So what are we giving Kimberly?
Paige can
Kimberly,
be the media chick.
The medical chick.
medical chick.
Yeah, and Kim the medical chick. Medical and media chicks.
Or the front page chick. I like the front page chick.
Yep.
Front page chick.
Front page chick and the medical chick. Grab the air.
Yes.
Grab the air.
Thanks, ladies. You all have a wonderful day, rest of your day. Love you guys. It's the Hey Girl Hey podcast, the Urban Media Today.